So Mom broke her elbow last week. She had a fall at her house, and the next day we took her in to get x-rays because it was swollen. And some of you might have seen some of my other videos where I am so frustrated with the healthcare system. I work in the healthcare system. I'm a physical therapist, have been for 20 years. And for years I felt like the healthcare system had to get better. It couldn't just keep getting worse. And then COVID happened and it did. And I came really close to leaving healthcare altogether, because it was so frustrating to not be able to do anything. So that's when I started making these videos. So not only do I see the family's frustrations, I live it, because I have a 90-year-old mom, and before her I took care of my 101-year-old uncle. As I got to the point where I was trying to decide whether I was going to leave healthcare or not, I realized if I'm going to stay in healthcare, then I have to figure out a way that I can feel like I'm doing something. So that's what these videos are for, to help you as a caregiver to feel like you can do something, because the healthcare system isn't going to change. We have to figure out how we can work within it and how we can advocate best for our loved ones and ourselves. So Mom had a fall. She broke her elbow. Her doctor's office sent her to have x-rays, and then within an hour of getting the x-rays, it showed a minimally displaced fracture at her elbow. Minimally displaced is a good thing. It means there's a fracture, it's broken, but the piece is kind of held in place some. So as long as the piece stays where it is, it's okay. If it moves, sometimes they have to do surgery, and the elbow is one of those joints where the nerves and the blood vessels are really close. So you're hoping that that piece isn't gonna impact the nerves or the blood vessels. As I went on the portal, it basically said what I just said about her fracture, and it recommended that she use a splint and to see an orthopedic doctor ASAP. As a physical therapist, I know that a splint isn't all that's involved in this. She should be encouraged not to move the arm, not to use it, including to stand up, which is pretty hard for a 90-year-old, because we don't want to move that piece that's in there. But the portal didn't say anything about that. My strong feeling is that doctors are mandated, they have to communicate with their patients. And I feel like the portal has become a way for doctors to say that they're communicating with their patients. I've seen patients who didn't know they had a stroke a year ago, or who didn't know that they had a specific diagnosis. In our case, we were really fortunate because there's somebody in the family that has some kind of medical background. But most families don't have that. And so for them to read something like that on the portal, they're gonna maybe get a sling for their mom or dad, and then they're gonna watch as their parent uses their arm to stand up or uses it to lift something. And that's so frustrating to me. So if I were in the position where I didn't have any kind of medical understanding, and I went to the portal and I see that my mom has a fracture, the two questions that I would ask, and I would probably call the doctor's office. You can also message within the portal, and sometimes that can be faster, but I would ask two questions. Is there any weight-bearing restriction? Because that's going to tell you a lot about what you're going to try to help your parent to avoid doing. And is there any movement restrictions? So those two questions are super important until the follow-up is done with the orthopedic doctor. I'm going to do a video later in the week where I'm going to talk about what it kind of means if your parent does have a weight-bearing restriction or a movement restriction, and how it impacts everything they do on a daily basis, and how you can kind of help them to find alternative ways to do things as much as possible. Nothing is ever 100%. As I work with Mom, I find myself constantly telling her, don't forget, Mom, you can't use that arm. Don't forget, you can't use it to do this. You can't hold anything with it. And it's a hard thing. We can only do the best we can do. So in the next couple of weeks, I'm going to be showing some different videos on ways that we can help. And I'm going to show Mom's progress through the process. Mom right now has a brace on her arm, and she's supposed to hold it at 90 degrees of flexion. And they're hoping we'll go back to the doctor next week, and they're hoping that they're going to avoid surgery, that piece that's in there is going to stay where it is and isn't going to do any damage where they'll have to go in and do surgery. Surgery can be a sketchy thing because it's great because it's going to hold the bone in place, but especially for somebody 90 years old to be held in a certain position for weeks and weeks and sometimes even months, it can lead to a lot of loss of function of that extremity. Thanks for watching today's video. I'll talk to you soon.